Bipolar II affective disorder is a mental health condition that is caused by repeated episodes of depression and episodes of hypomania, which disrupt daily life, work, and relationship. Managing bipolar II affective disorder is very important in that wrong treatment can make symptoms worse instead of better. In today's video, I will explain the best management of bipolar II affective disorder, in that knowing how it is properly managed will help us to improve the mental health services in our communities. So if you are still new to this channel, I request you to subscribe because this motivates me to make more content for you. So the first line treatment for bipolar II affective disorder is the mood stabilizers. In my previous videos, I've been teaching you of how to avoid antidepressants in people with bipolar affective disorder. Is that now here in this video we are saying that the first line treatment for people having bipolar affective disorder, that is bipolar 2, is mood stabilizers. Okay, examples of mood stabilizers that we have is we have carbamazepine. Okay, we have also lamotrigine, we have sodium valproate, and also lithium carbonate. So these are the drugs which are available for us to give patients in our hospitals, in our health facilities. Okay, drugs like lithium carbonate, they are drugs of choice in that you have to do a lot of tests to ensure that someone's livers are functioning normally, because they have a lot of serious side effects. So they are a drug of choice. Okay, then we have to monitor their side effect for each of the drugs that we give. For example, sodium valproate is not recommended in people with reproductive age, that is the females from the ages of 12 and above. Okay, then carbamazepine tablets, also we have to look out for the side effects like Stevens-Johnson syndrome, where you find someone's skin dark patchy skin, or like you find the skin is turning dark. That is called Stevens-Johnson syndrome. The second type of medicine that we use with people with bipolar affective disorder too is that is what we call atypical antipsychotics. Okay, so if you are managing a patient who has bipolar II affective disorder, is that many organizations, many researchers have carried out research, is that they advise us to use second generation antipsychotics, where we find drugs like olanzapine, like quetiapine. Okay, they are good in people, they are good for managing people with bipolar II affective disorder, in that these drugs have few side effects compared to first generation antipsychotics like chlorpromazine, haldol, olanzapine. But depends on the facility that you are working. If you are working in a facility where we are having first generation antipsychotics like chlorpromazine, haldol, okay, flufenazine, okay, we would recommend that you give them, they will benefit from them. A combination of olanzapine and fluoxetine has proven to improve bipolar II affective disorder according to research. Okay, so these drugs are able to stabilize someone's mood. Okay, because someone keeps on shifting from extreme happiness to sadness. Okay, so if you are still new to this channel, I request you to subscribe because this motivates me to make more content for you. And if you are watching us from South Africa, Denmark, UK, USA, people from Kenya, people from Uganda, thank you so much for watching our videos. And may you share this information to our friends, our relatives, so that they can also get this information, because mental health is very important. Okay, option number 3 about treatment is that there is use of antidepressants, but here the different researchers tell us that let us use antidepressants with caution. Okay, they are not advised to be used as a monotherapy. A monotherapy means using one drug to treat a condition. Okay, so researchers advise us that if you have someone who is having bipolar II affective disorder, that you avoid using antidepressants like fluoxetine and triptyline as a monotherapy, or any other antidepressants that you may be having. So they advise us to combine antidepressants with mood stabilizers and antipsychotics. Okay, then lastly, we have looked at the medicines that we use. We have said that we use mood stabilizers, we use the typical antipsychotics, but if they are not there, we can use typical antipsychotics. Then the third one, we are saying that we can use antidepressants, but this time we are not using them as a monotherapy, but we shall use it as in a combination with other drugs. The last point on managing a person with bipolar II affective disorder is there is what we call psychosocial interventions. Okay? In every mental patient, there is what we call psychosocial intervention. We have to use psychological ways of how to handle that person. Okay? So we have what we call psychotherapy. So psychotherapy means a talk therapy, or it's a type of counseling, but this time it is more than counseling. So we have different types of psychotherapy. For example, cognitive behavioral therapy, where you identify a patient's negative thinking pattern and you replace it with a positive thinking pattern. Okay? So for example, someone thinks that no one loves me. Okay? Then you ask them, don't you think this person who has brought you in the hospital cares about you and loves you? Okay? Then the patient will start thinking twice. Then he says yes. Then he has to challenge that negative. So in cognitive behavioral therapy, or CBT, we aim at identifying a patient's negative thoughts and replacing them with positive thinking pattern. That is called cognitive restructuring. Okay? We encourage also social support. In that, social support means that we encourage family members to support this person with medicines in case they are lacking medicines. If they are lacking money to buy drugs, we encourage them to give them some money to go out and buy the drugs. Okay? We encourage family members to know how to handle this person in case he breaks down, and also to encourage them to take their medicines faithfully according to how the doctors have prescribed them. Okay? So this is the best management for someone who is having bipolar II affective disorder. And as I finish, a summary is that we use mood stabilizers, we use antipsychotics, and in this case we are saying atypical antipsychotics, and also we use antidepressants, but with caution. Then the last one is we bring in what we call psychosocial interventions. So if you are still new to this channel, I request you to subscribe. I'll see you in my next video.